What does HGPIN mean in your prostate biopsy results? If you've received a prostate biopsy report mentioning HGPIN, you might be wondering what that means for your health. HGPIN stands for high-grade prostatic intraepithelial neoplasia. This term indicates that there are abnormal changes in the cells of your prostate gland. These cells appear more atypical than those seen in low-grade prostatic intraepithelial neoplasia but have not yet developed into invasive cancer. HGPIN is classified as a precancerous lesion, which means it can be a marker that may precede the development of prostate adenocarcinoma, the most common type of prostate cancer. Understanding the nature of HGPIN is crucial. It represents abnormal growth of the epithelial cells lining the prostate glands. While these cells show significant irregularities, they remain confined within the gland and have not invaded surrounding tissues. This distinction is important because it helps differentiate HGPIN from actual prostate cancer. HGPIN is not just a benign finding. It is associated with an increased risk of prostate cancer. Research indicates that men diagnosed with HGPIN have about a 30% chance of being diagnosed with prostate cancer on a subsequent biopsy, particularly within the following years. This makes HGPIN a significant marker for monitoring. The diagnosis of HGPIN is made through a microscopic examination of prostate tissue obtained via biopsy. Routine blood tests, digital rectal exams, or imaging studies cannot detect HGPIN. Therefore, if your biopsy report mentions HGPIN, it is based on a careful examination of the tissue sample. Clinically, HGPIN is more important than low-grade prostatic intraepithelial neoplasia, which is common and not linked to cancer risk. HGPIN indicates a higher likelihood of finding prostate cancer, either missed in the initial biopsy or developing later. While HGPIN itself does not require immediate treatment, it typically leads to closer monitoring. This may include repeat prostate biopsies to check for the presence or development of prostate cancer. The timing and frequency of these follow-ups can vary based on individual risk factors and how well the initial biopsy samples were taken. Interestingly, some studies suggest that if multiple biopsy samples show HGPIN, the risk of finding cancer later may be higher. However, this relationship is less clear with modern biopsy techniques that use extended sampling. It is essential to note that there is no standard treatment specifically for HGPIN. Instead, the focus is on surveillance and early detection of any progression to cancer. If your biopsy report mentions HGPIN, it indicates that abnormal precancerous changes were found in your prostate cells. This finding calls for careful follow-up with your healthcare provider to monitor for potential development of prostate cancer, but it does not mean you have cancer right now. Your doctor will guide you on the appropriate next steps based on your overall clinical picture. Always remember to consult your healthcare professional for personalized advice regarding your health.